from all over the county. Sometimes we have separate roundtables for North and South County, but this one is a clearly North county-wide issue of concern. And our procedure has usually been that we have presenters, as we will today, and then we open the floor. But the way we open the floor or in an orderly fashion is by people posting comments and questions on the chat, which I, as moderator, channel to the general group. And then if there's time and need, we can open the floor to verbal participation. Um, I think the people who are presenting, you will have to decide ultimately whether you want to just open the floor or whether the chat room procedure is best. It's a way of not getting us bogged down in a lot of interchange, but that give people a chance to have their questions and comments uh, uh, brought to everybody's attention. Um, so I'm going to turn the meeting really over, I think, to you, Gail Osherenko. She's active in SBCAN and also more relevantly right now in the League of Women Voters. We have also with us Larry Severance of Clue and Lynn Gibbs from NAMI. But Gail, why don't you take it and introduce the whole thing and see what you and tell us what you want to accomplish? I think this be an unusual roundtable because there may be more role for people in the wider group to have a voice in what is the outcome of this event. So go ahead, Gail.
Thanks, Dick. Really appreciate it and appreciate all the work Nancy did to get us here and get it set up. I have just posted in the chat the link to a petition that Clue and the League have put together to urge people to sign, to send a message to our Board of Supervisors that we would like them to reduce their decision to build 1.5 housing units add to the North County Jail to only one for reasons that I'm going to actually turn the meeting over to Larry Severance to give you some background. But if you want to go to the link, you can see what the petition looks like, and hopefully you'll be convinced to sign it and share it with other people in the county. They will ask you for your zip code, or I think I don't think that shows up, but we will get it at the end to be able to deliver the petition signers to the board. And
Gail,
yeah,
it
we're
shows up,
basically
the zip shows up when you sign. When you go to
okay.
sign, it indicates the location in the zip.
And when I signed it, it showed the wrong zip code for me, so I changed that. But anyway, that's what we're largely going to be talking about today. And Larry's made some real preparations to share the message. So I'm going to let him do that.
Thank you, Gail. Good morning or good afternoon, everybody, and thanks for the opportunity to be here today. Clue Santa Barbara and the League of Women Voters for Santa Barbara, with Gail being one of those folks. Pam Flint Tambo is here today. There's others as well. We've collaborated over a period of several years as advocates within the criminal justice system of our county. And I'm going to highlight today some of the history briefly that brings us to the issues that are before our county voters and our county supervisors relating to how big or not big our jail needs to be. So to start with that history, I want to go back to COVID 2020 and 2021. There were over 900 people in the jail, and COVID started to spread through the jail. And public health became aware of the concern that people were getting sick and they said, this is a public health crisis. You need to reduce the number of people that are in that jail because it's a massive congregate care facility and it's causing lots of infections. So the probation department and the sheriff got together. They revised their risk criteria and they decided to release 37%, a reduction from the prior year. So they went from 903 jail residents in the prior year down to 580. The sheriff cautioned that this was not a good idea because now these folks were all back in the community and there was going to be undoubtedly impacts in terms of crime in the community. A year later, the Santa Barbara civil grand jury decided to study what the impact of releasing those folks into the community was. They did as good a study as they could with the data available, and they found there was no significant impact to those folks being back in the community. In fact, in a couple of measures, there was a reduction in crime. And so the light bulb came on that we're jailing people who don't need to be in jail to protect public safety. And so CLU, the league, we started to go to the supervisors and point this out. There was another element. This is the second part of the historical context. Our jail in the South County was built over a period of 50 years. The facilities run by the county, the sheriff operates what goes on in the jail. In 2017, a disability rights group representing all of the jail residents brought a lawsuit against the county and against the sheriff, claiming there were inhumane conditions in that jail. The lawsuit was called Murray versus the county and the sheriff. In 2020, a stipulated judgment, which means all the parties agreed, was entered saying, yeah, the jail has got problems. And the county agreed to make fixes or changes to the physical plant. The sheriff was signed off that there would be changes in the way healthcare was administered and how the jail was operated. And ever since then, the federal court that supervised this case and signed off on that stipulated judgment has had experts monitoring whether the conditions are improving and so forth. So the Murray lawsuit drove the county to study what would the cost be of fixing up the old jail. Conclusion, cost prohibitive. Alternative, let's build new beds in the North County Jail, which had opened probably about 2021, early 2022. And so the tug of war then became, well, how many beds do we need? And the sheriff's department felt we needed the equivalent of 2 housing units. Criminal justice advocates said, wait a minute, we really don't understand how many people are in jail that don't need to be there. We should pause this decision. The supervisors, feeling under pressure because of the Murray requirement that they make some progress, decided to plan for 1.5 housing units. And that's what we're talking about today. And the question became then, well, do we need, that would be a total of 384 beds. Do we need all those beds? Some of the parts of the South County Jail were closed. Isolation cells were closed. One of the medium security areas was declared unsafe for earthquakes. It was closed. They're going to reduce the footprint of the South County Jail down to about 116 beds in an intake center. But then the question is, do we need to build all of these 384 beds in the North County? That decision to go ahead with planning was made in April of 2025. But at the same time, the supervisors said, hey, let's study diversion alternatives. A group called the Community Corrections Partnership that administers at least makes decisions for the recommendations to the supervisors how to spend a chunk of the criminal justice budget each year, was designated to study diversion alternatives, which is basically, are there folks in jail that don't need to be there? Can we get them out? Which would impact the size of the jail population, which would impact the number of beds we actually need going forward. So they kind of put the cart before the horse by voting on the size of the plan before they started the diversion study. But they did start the diversion study, and it came back through the CCP. And I might add that a number of the people here today were public participants in that conversation and had input for the diversion study.
No, it's the jail diversion, the jail funding. There's a panel.
Oh, yeah. You sound like you might be on the team, the lead team. that
I'm
meets
sorry,
every
I'm not sure
Thursday.
who's talking.
What's
but-
that? Oh, okay.
It sounds like somebody doesn't have their mic off. In any event, so the jail diversion study came up with some recommendations. I'll get into those briefly. But let's talk about who is in the jails that could be safely released. And so there was a snapshot done, and this was a study that involved the sheriff's department, probation, public defender, district attorney, and the public. So there was conversation all around the table and collaboration and bringing data together. In a snapshot in July 2025, they identified as high-risk people in the jail, figure they're not likely to be released by judges, 306 people. And they had 46% of the folks in the jail were either accused or doing sentences for what are considered violent felonies. That was 342 people out of about 744. So less than half the people in the jail arguably have high risk for reoffending, arguably because of the nature of violent charges, might be a danger to the public. There were 111 people in that same survey that had been identified as low risk, and there were 258 people that they didn't bother to assess. So if you take the low risk criteria, at least that many people might safely be released back into the community. So the tension has really been, do we need mass incarceration to protect the community? Or do we need, and does it have a deterrent effect, or does it not? I want to call your attention to a meta study, which is a study of studies that looked at 116 different studies that had asked the question, hey, does giving people jail work better than giving them probation, supervision in the community, but not jail? The outcome of the meta study, I'll read you in essence. Custodial sanctions, that means jail or prison, have no effect on reoffending or slightly increase it when compared with the effects of non-custodial sanctions such as probation. So for a large, the data show that jail doesn't really have a different impact than community supervision or probation. So that's another reason to ask, why are we jailing all these folks that are low risk? I'll highlight what the jail diversion study recommended, and then I want to be sure there's plenty of time for folks, so I'll try to wrap up. There's a program started by the Public Defender's Office called Early Representation Program, or READY. Most of the procedures that occur in criminal justice, somebody's charged, somebody's taken to jail, they're booked on a charge. About 48 hours later, they come before a judge to decide if they're going to have bail or not. They haven't met an attorney. Usually it's a public defender, because most of the people in our jail are indigent. And so the public defender is not equipped to say what the circumstances of the individual are. So guess what? The judges often leave them in jail. The early representation program deliberately created the opportunity for public defender staff to get together with their client ahead of that arraignment. And what they found was a number of the cases got dismissed. There was a 27% reduction in the amount of jail time those folks spent in jail relative to people who weren't in the early representation program. So that's been identified as one way to reduce the jail population. It's operating in North County right now, and the statistics show that you could basically subtract 14 beds from the jail for that program in North County. It's going to be extended into the South County, where the jail population experts projecting another 10 beds would be no longer needed. Alternative Sentencing Bureau. This is run by the Sheriff's Department. And it is the option for some people who are in the jail of having electronic home monitoring. And the Sheriff's Department or the Sheriff's Office has been, in the eyes of some of the supervisors, underutilizing that option to reduce the jail population. So the sheriff's been before the supervisors, there's been dialogue, and there's been encouragement to increase the number of people that could be released from the jail into electronic home detention. There are 40 people roughly right now, and that's a steady number. In fact, it's increased over the last year. 40 people in jail who have been court ordered to be released into treatment. They're still in jail because there's not a treatment facility to accept them. So we have an underutilization. We need more resources in the community. And if we had, and these are primarily mental health or substance use addiction, the treatments that are being called for. If we had more resources in the community, spend money in that direction rather than building jail beds, we could reduce the jail population by another 40. So that's basically where CLU and other advocacy organizations have come to the conclusion that we need to give the diversion opportunities a chance, and that overbuilding jail beds right now is the wrong thing to do. Gail will probably mention that we have a serious budget crisis in this county. It's been exacerbated by the federal cutbacks, but that's the basic situation in terms of the history. The supervisors are going to have to decide in the next few months, it's related to the 2026-2027 budget, whether they're going to go ahead and build this additional 1.5 units. We calculated the cost of the one unit with operation, construction costs, and financing. It's about $146 million. Right now, our county budget could use that for a lot more things than building additional jail beds. So I guess I'll stop there. Gail, you want to add anything, or and I'll leave it to Dick to suggest whether when questions are appropriate.
Since Larry asked me to, I guess I'll mention that the most figures we have, by the way, come from figures that the county has put out. And back in December, our Board of Supervisors brought us the kind of scary, terrible news that we're looking at $66 million shortfall over the next 5 years, and 23 million in cuts in the next fiscal year to social services and the safety net programs. And a lot of this is due to federal cuts, maybe federal and state cuts. They've also suggested that our county may have to look at a sales tax increase, which is about as regressive a way of raising money as possible, which is why it really seemed to us that reducing the number of jail beds they plan to add to the North County would be a good way to begin to address some of that deficit that we're facing. And we calculated, based on the county's figures that we got in April, that if we don't build the extra half pod, 128 beds roughly, and we only build 256, that we could save $147 million. That's a number that includes whatever we spend the year that the board decides on a contract, and lets a contract, and probably probably 20 years, about 2 decades of financing the rest of the cost of building the jail and operating it. But, if we overbuild the jail, we end up with too many beds and too much operational cost over, decades, long, long time. So I guess that's what I wanted to add, and gives you a picture of and where they're cutting right away. They already have asked the health department and social services. They've basically frozen any new hiring. So even positions that had already been authorized for, our base services in health and social services have been told you can't hire. And they're trying to just put those jobs in abeyance while they amass about $50 million, which will be towards the initial down payments. That's all I had to answer, but maybe we should go on to Lynn and let her talk and then come back to questions. Bob, did you have something you
Well,
wanted
I just wanted to add that the vote for the additional half pod was designated as mental health beds. And I don't think any member of the public has any clue what that means, what the costs for that would be, notwithstanding the bottom line that is very clear that the jail is not the place for mental health treatment. So I just wanted to add that point, that's a big question mark, the dollar value of which no one knows, and what would be involved. Another problem.
We should clarify that both jails, South County and North, have some what they call behavioral health units that they configured to be smaller units so that people with behavioral health issues would not be, residing in a big unit with 64 people or even 30 people. So they're smaller units, and they try to bring in more programming, but it hasn't really been the kind of therapy treatment that any mental health facility would call real treatment. It's been keeping people more occupied, busier, groups coming in and playing puzzles. It's not what you would get if you were in a acute or subacute facility. I don't think Larry mentioned we have about 40 people in the jail who have been ordered to
I did
divert.
mention that.
So, and we don't have places for them all to go. And that includes, places for substance use disorder. Lynn, can we turn it over to you?
Yes, thank you. And I want to thank you for inviting me. I'd like to share my screen for the presentation, and I think I'd like to hold questions until afterwards. It's a pretty brief presentation.
Sure, go ahead and share your screen.
Okay, can you all see this?
Yes.
Okay, so I'm Lynn Gibbs. I serve as Public Policy Chair of the NAMI Santa Barbara County chapter, and as an advisor to Families Act, which is a local organization. For those of you who may not be familiar with NAMI, NAMI stands for the National Alliance on Mental Illness. And it was founded as a grassroots organization back in 1979 by two mothers of sons with schizophrenia. and it grew nationally to become the largest grassroots mental health organization in the country. Our mission is it's multiple. It's advocacy, education, support, and public awareness to help those affected by mental illness build better lives. In Santa Barbara County, this entails our relentlessly pressing for a full, adequate, and accessible continuum of care for our loved ones. I should say that my personal experience is that I have a daughter who has been a county mental health client for 25 years. And so I've, by necessity, had to get to know this system very well and many of the staff who work for the Department of Behavioral Wellness. Families Act is also a grassroots organization in Santa Barbara, and it's dedicated to supporting families affected by mental health and substance use issues through advocacy, education, and community engagement. Historically, Families Act has been focused more on substance use disorders, whereas NAMI was focused more on mental illness. But now there's just a lot of crossover, and NAMI and Families Act work closely together. So there's kind of a famous graph that illustrates that there's a very direct and opposite relationship between the number of treatment beds that are available to people with mental illness and the number of people who are in jail beds. And this is a national chart. So as over the years, since 1960, since the number of hospital beds for people with mental illness has been greatly reduced, we've seen a proportionate increase in the number of people who have been jailed. And many times their crimes are directly related to symptoms of their mental illness rather than a criminal ideology. So, there's no difference in Santa Barbara County. Counties throughout the state have seen a higher percentage of their jail populations occupied by people with mental illness. Mental illness in our jail. In 2017, the Santa Barbara County Department of Behavioral Wellness did a jail snapshot. They took a list of the census of the jail on that day, everyone who was in the jail on that day, and they matched it against their own records. Now, I should say that the Department of Behavioral Wellness is charged with treating people with moderate to severe mental illness. There's another organization, SENCAL, that treats those with mild mental illness. So here we're talking about more serious mental illness. So on that day, 52% of people in the jail were or had been patients of the Department of Behavioral Wellness. It's a pretty high percentage. And 47% had received substance use disorder services from BeWell. So altogether, 60% of the jail population had received either mental health or SUD services from, we call it BeWell, the Department of Behavioral Wellness. And this is consistent with an LA County estimate that 64% of its jail residents suffer from mental illness. So we in NAMI and Families Act feel that we're only going to be able to sustainably reduce the jail population when we address what needs to be done to reduce the population of those with mental illness. So as part of the jail diversion study that Larry mentioned, there were jail statistics reported by the Sheriff's Department. And they reported that 73% of the jail residents with serious mental illness had been there at least one time before. And a number of them had been there many times. And then most striking to me is that 47% of those with SMI in the jail had 10 or more arrests. And I think this has to tell us that whatever we're doing in the community when people leave the jail is not keeping them from recidivating and winding up back in the jail. It's kind of a merry-go-round. Now, in these jail statistics, the Sheriff's Department reported that 11% of jail residents carry an SMI flag. And that means that they've been diagnosed by the jail health provider
I would have
with a serious.
if you didn't answer the phone.
I'm sorry. Could you put yourself on mute? Thank you. So 11% had been diagnosed by the jail healthcare provider as having a serious mental illness, schizophrenia, or something of that nature. Now, we think that's a low estimate. For one thing, it doesn't count the number of people who in the jail were diagnosed with serious substance use disorders, and we know there are a lot of them. And we know that there's often a heavy crossover between substance use and mental illness. And that many times people will get diagnosed with a substance use disorder when in fact they also have a serious mental illness, but that's not being diagnosed. In a grand jury report on deaths in the jail, one of the women who died in the jail, we know had a long time diagnosis of very serious mental illness outside the jail, but that was not recognized in the jail. So we believe that that 11% figure is low. Another reason we think that is that those jail statistics said 15% of the jail residents were incompetent to stand trial. Now, you've got to be pretty ill not to be able to comprehend the basic court process. Who the DA is, why you're there, who your public defender is, what are the consequences of your potential consequences of your charges. And so, to think that there's a higher number that are incompetent to stand trial than are carrying an SMI flag is curious. And what it means when you're IST or incompetent to stand trial is that your case can't proceed until you're either made competent to stand trial. And sometimes that entails a stay at a state hospital, and the state hospitals are backed up. And so once someone is designated as IST in the jail, they can stay there for, quite a while, waiting for that to be resolved. And, in some cases, people have waited more than a year in the jail for a placement at a state hospital. And the jail is no place for somebody with a symptomatic serious mental illness. It's bad enough for someone who does not have that. And then the other thing the jail statistics said is that only 3% of the jail population were on misdemeanor charges. Those would be the easiest cases for diversion. But then when we do divert them, they often return to the jail for lack of adequate treatment in the community. So we have serious community-based service gaps for people with mental illness. And last year, the county commissioned a study of its jail diversion programs by a group called Research Development Associates. They're actually still working with the county now. They said that even with strong planning and qualified staff, insufficient housing, outpatient programs, and trauma competent care reduce the effectiveness and scalability of mental health diversion. To improve the continuum of community-based services, it's essential that the county takes proactive steps to ensure a coordinated, accessible, and effective network of services that meets the diverse needs of this population. And yet, in the jail diversion study that was charged with recommending ways to reduce the jail population, did not address any recommendations related to mental illness. And so, NAMI and Families Act, these are some of our recommendations for reducing the mentally ill jail population. It's not as if we don't know what needs to be done to achieve that. There are many things we could do that we're not doing now. And one is to increase the number of residential treatment beds at higher levels of care. We looked at that chart that shows, the consequences when we don't have treatment beds. The Rand Corporation recommended that there be 40 to 50 inpatient psychiatric beds per 100,000 population. And in Santa Barbara County, we have just 16 beds at our psychiatric health facility. And then we have an additional 20 beds at Cottage Hospital, but the beds at Cottage Hospital are not Medi-Cal eligible, and they are voluntary only. So you can see that we have a severe shortage of treatment beds. Almost 10 years ago, the county had a plan to build a forensic mental health treatment center, which would have been a secured locked facility for people who weren't, otherwise eligible for diversion in the community because there's more security needed for them. And when their estimates of how much it would cost came up $1 million short of what they had in reserves, they decided to scrap that plan. So, for lack of that $1 million, they did not move ahead. And yet now we're considering an expansion to the jail of multi-millions. We believe some of that money should be spent on the community-based treatment that we need to keep people with mental illness out of the jail. And so I need to keep this brief, and we could talk about, our recommendations for, a long time, but I will just cite them all here for now. We think we need to address the underutilization of the existing treatment facilities that already exist in the county. We have a South County Crisis Stabilization Unit. This is a place where people can go in crisis for up to 24 hours of stabilization. So they could, in theory, be taken there instead of the jail in many cases. It's a locked facility and it's defined at the highest level of care. We have a capacity of 8 beds there, and yet on any given day, there's an average of 2 people there. And as a consequence, when people wind up on involuntary psychiatric holds at Cottage Hospital, they often have to be discharged back to the community with a cabled together safety plan, and in some cases they're placed out of county in inpatient hospital beds out of county. That makes it very difficult to step them down to treatment when they're released. One of the recommendations we've recently added is something I more recently became aware of, that we're still using unlicensed residential treatment settings in other counties. And some of our most ill patients are going there. There's one now in Los Angeles County that is unlicensed and substandard and no real treatment going on there. And communications are very limited to the outside. And once we place someone in an out-of-county facility, our mental health staff are so overwhelmed that often it's out of sight, out of mind. And we're not sufficiently tracking what's happening to them when they get to these places. But we should only be using licensed facilities that we've assessed and know that are good for our loved ones with mental illness. And then there are nationally recognized evidence-based programs that we think need either to be adopted by the county or enhanced by the county, such as assertive community treatment, forensic act, assisted outpatient treatment, and early first episode psychosis treatment. I'll just mention here that assertive community treatment is a wraparound intensive outpatient treatment service with a 10-to-1 ratio of clients to clinicians, which is a pretty good ratio because in the general mental health clinics, the ratio can be more like 100 to 1. They're 24/7, by definition, whatever it takes services and community-based so that clinicians go out into the community to see their clients. So they're meant for the people with the most acute mental health needs who need that level of service. Last year, we discontinued our ACT program because it was felt that the department felt they weren't able to do it to the evidence-based standard. And so what we have now is something called the Adult Full Service Partnership, which is similar to ACT, but with some of the requirements not the requirements aren't as high. And they're not always being met. We have a shortage of staffing in our adult full service partnership, the standard being a 10-to-1 ratio of patients to clinicians or staff, whereas ours is more like 20-to-1 now. And this is the outpatient treatment that can keep people from needing to be hospitalized or having to be arrested or spending time in the emergency room. So it's very important, and we would like to see an assessment of that program for what staffing is needed. We also think it's important to sustainably fund our county's co-response program that avoids criminalization before arrest. This entails a law enforcement officer being partnered with a clinician, and they go out in unmarked cars on crisis calls, and they're very heavily trained in how to de-escalate crisis situations. And we have that program now, but it's been funded by ARPA, and so that funding is expiring in June. And we think it's really important to continue that program, lest we see additional arrests taking place. That program's been really successful in really and having a very small number of arrests result when they respond to a crisis situation. The next thing we recommend is to track the outcomes of all treatment and diversion programs. The RDA study I mentioned said that of the seven of the 8 diversion programs that it was charged with assessing, they couldn't really make an assessment because they didn't have the outcome data they needed to see how successful those programs were. And we believe the same is true for mental health treatment programs in the community. And then our final recommendation is to appoint an advisory council inclusive of community stakeholders to follow implementation of the above recommendations. We really do know a lot in the community, and we really do have something very important to contribute to jail diversion efforts. Um, in uh, in February, coming up very soon now, there's going to be a series of community forums where RDA will present the work that it's doing right now on how to uh, address the jail population and reduction of the jail population. So we're urging everyone to get out for those meetings. We're also urging on February 10th, the County Board of Supervisors is going to hear a presentation on the co-response program. And we are fighting hard to maintain that program. It's very important. And so we're urging anyone who's able to come out to that Board of Supervisors meeting or to join virtually. And if you have a personal story about how co-response has helped someone you know, to tell your story. So I may have gone a little longer than I had intended, but thank you. So to close, I was just looking for a quote, and I came upon change happens when ordinary people demand it. So it's not as if we can't do better. We can do better for people with mental illness, and we can reduce the jail population if we put our mind to it. Thank you.
I'd like to intervene and ask you a question, Gail. Is it my impression that this county lags others in the kind of services in mental illness that you're talking about? Is that true?
Well, services are very much county specific. And I probably there probably are county, well, we know there are counties who are doing better. There probably are counties that are not doing quite so well. But one thing that struck me was a recent report by the California Department of Health Services um, that said of the 58 California counties, we are 54th in the degree of penetration of our county mental health services.
And you folks
That's pretty striking.
that's right.
We
And you
should,
folks have been advocating for this not just now, but for a period of time, right?
oh, for decades.
Right. So what I'm looking for, is there any way to explain this persistent failure of Santa Barbara County on this dimension?
Leadership,
Well,
failure of leadership on
Well,
the decision makers.
Yeah.
it's hard for me to explain or comprehend. It's, a lot of it has to do with money, but we know that we're probably spending more on crisis and incarceration and court proceedings for people with mental illness and disability, homelessness. I mean, the list goes on and on.
and is there any member of the board now who is a champion of what you're advocating?
Our board has been pretty supportive. I would say as supportive, um, um, as well. I don't know as supportive as we would like because we'd like to go to a
No.
further degree, but they have championed two of our strongest advocacy initiatives. One was for our outpatient treatment program that's a civil court-based program that we had to fight very hard to get. And they voted for it, and we have implemented it in the county, and it's become successful over the years. The other is co-response, but the funding for that is temporary, and so we're going back to them to ask them to help sustain that program.
Okay, so I want to turn it back to Gail. And what do you hope will come next in our conversation here?
Um, well, I do want to get to other people who want to speak, but I wanted to say to the question of our Board of Supervisors that both Laura Capps and Joan Hartman have been very supportive of having only one uh, housing unit, 256 beds added, but they voted for the 1.5 because they were quite fearful that the sort of swing vote, Roy Lee might go, with the North County supervisors, and we might end up with 2 housing units. So I wanted to say we've had good support on the jail front and building out the jail. So
All right, so before we open the floor, I want to find out whether the following two things need to be done. First, Larry is one of our presenters. I want to offer him the chance to speak, but would you like to say more about what's in the petition and what you would like people to do with it before we turn the floor open? Would that make sense?
I put a shorter link to the petition in the chat, and
Well,
we
I
really
think
want people to
I
sign
think a
it.
verbal summary would be helpful.
The verbal summary is basically it's a petition to ask the board to pull back on the vote was taken last April to add 1.5 units to the North Branch Jail, and instead to only add 1. And it's important to understand this will take the total number of beds available to 748. But after what the addition would be made. And that's only about 2 short of where the jail is averaging now, which is 750 people. I think it will mean closing around 300 beds in the South County and leaving us in South County with only 116 beds in the IRC, in the intake and reception area. We do have, if she's still here, our public defender on board. And if there's anything we've said that's not accurate or she wants to add, that would be useful.
Okay, Larry, why don't you jump in and then we'll open the floor.
Yeah, I wanted to just address the problem of not having enough mental health resources in the community. Tony Navarro is the director of behavioral health in our county.
Wellness.
Behavioral wellness, thank you. And she was part of the conversation during the jail diversion meetings and came up with charts that suggested there's enough resources in the community to meet mental health needs. The problem was when she was asked, are those available to justice-involved people? Well, the answer was not really. They have contracts with providers for beds in other counties and various places, and those contracts generally had not specified that the recipients would need to take people who are justice involved as well as not. So there's a blur because on the one hand, Navarro's saying, well, we've got adequate resources. But when you ask about justice involved, which is what we're talking about, reducing the jail population, not so.
So they're thinking that part of their service is to send people to other counties. Did I understand that as part of what you're saying?
There's inadequate beds in this county, and they contract to send folks out of county. There are some proposals that are competitive proposals for funding to build additional beds in this county, but it's up in the air. One proposal was not successful, and so right now, yeah, we're contracting with other counties for some of those beds.
And the proposal for additional beds are for beds at the lower level of voluntary care, and so many people, it's a mismatch for many people with serious mental illness.
Okay.
They tend to leave as soon as they're placed there.
All right. I before we turn the floor, I really want to make sure we get this petition adequately understood. So, how do you want organizations to co-sign this as
May I
such?
address that?
Huh? Yeah.
Yes, we're looking for two sources of support. One, we feel if we can build a collaboration of advocacy organizations and make it known to the supervisors and to the public that there's a broad cross-section of support for reducing the planned jail expansion, that's going to be helpful. The other thing is we're trying to reach as many voters in the county as we can. The districts of the supervisors encompass the entire county, and basically get a showing that people are aware of this problem. They're aware of the costs. They think the money could be put to better use elsewhere. And so that the essence of the petition is asking for a reduction to 256 beds from 384, putting the savings, which we calculate to close to 147 million over time, putting those to meeting essential services, including things like hiring staff for the READY program, which will help further reduce the jail population. And the petition, by signing it, there's 4 bullet points that are basically common sense. And it's directed to the supervisors, asking them to vote to support this.
And this is on their agenda?
It's coming up this spring. It's part of the budget considerations right now. There's been a budget prepared by the finance department that's been submitted to the county supervisors. It includes a $50 million down payment on the jail, and the plans right now are to build the whole 1.5, and we're seeking to change at least one additional supervisor's minds, because 3 out of 5 could alter the plan.
So what I'm trying to be practical about this petition. What you're asking people sitting here today not only to sign it, but to, I would assume, copy it and take it to other people and ask for other people to sign it. Is that what you're asking for?
Yeah, if you sign this petition, there's they ask you to send it out to somebody else. So it's real easy to link it to email, Facebook. And we're also going to be contacting organizations, SBCAN, you're the first one, asking for endorsement on this petition. And we're going to try to get a version of it with the logos of organizations that support the petition into the independent.
So all of that information is in the link that you are providing us, right?
So Dick, the petition is up on change.org, and that the link takes people there. It's really designed as a place for individuals to sign. We will put essentially the petition in a letter and ask all the organizations to put their logos on it. But we're not in a huge hurry for that, because we don't yet have a supervisor willing to bring it back. So just sign the petition and get your friends who live in the county to sign it. And by the way, we just put it up before the meeting, and it has only 9 signatures now, but that's because we started the meeting. But hopefully after the meeting, those numbers will go up. They've gone up a little while we've been talking.
Yeah, we can get almost 40 signatures right away if we just do what we're told to do here.
We're inviting that.
All right. Well, there's people champing at bits, I guess. So, Gina.
Hi, good afternoon, everybody. My name is Gina Kuros, and I'm part of many organizations, and I'm an advocate. And I also have lived experience of incarceration and homelessness and drug addiction. One of the biggest gaps that we do have is in the jail strategy and reducing it is that we don't have an established or managed enforceable reentry framework for individuals with SMIs and substance use disorder and who are homeless. And as a matter of fact, they're excluded. The homeless people who are experiencing homelessness that are incarcerated or in institutionalized settings are excluded from the annual point in time count. So we do know that there's 40% that have identified as experiencing homelessness who are incarcerated. That's 298 people. By implementing like a reentry at the time of entry for these vulnerable population, we can reduce the jail population by a lot. People are they're released from incarceration with no ID, with no state or federal benefits, no cell phone. They should have a scheduled appointment. Those types of things, they're very easy, would reduce the jail population. And I did an analysis and if we were to start something like this from the get-go, we can reduce the population by 120 people, saving the county $7.7 million a year. And this would be ongoing. And that doesn't even include the reduction in emergency room visits, law enforcement, psych holds, all that type of stuff. So that's one thing that there's no solid reentry program for people. And this is why there's this revolving door of incarceration.
Thank you. This is very helpful. We're learning a lot. Cheryl.
Hi, my name is Cheryl Smith. I'm on the board of NAMI. My son is 41. He's got schizophrenia with anosognosia. He's been in and out of the jail for the last 3 times. He's had over 160 appearances in the criminal court schedule, largely for minor offenses. In fact, he's using the jail in lieu of hospitalization because they will not find him incompetent to stand trial. And so when he needs food, clothing, and children, he will commit a petty theft to land back in the jail. And not when he gets in there, he's been representing himself. So there's a whole string of events in the course of actions that occur with and for to these individuals that have serious mental illness. Many of them are unwilling to admit that they have an illness, so they're not going to participate in voluntary treatment, whether for substance use disorder or for serious mental illness. So my point being is that what we lack here in the county is a infrastructure for, as Lynn was talking about, those with serious mental illness where 24 hours, 48 hours, or 72 hours in a crisis response unit is going to be totally insufficient in order to be able to treat the mental illness for these individuals. And a lot of people are put off by the idea of involuntary treatment, but in fact, that is widely recognized as a good course of action for certain individuals like my son and those who are resistant to treatment because they are unable to recognize that they have an illness. And so if they go into involuntary treatment, that allows them to the trauma of their way of life on the street to be treated, as well as for them to receive the medical treatment and the talk therapy that might actually contribute to their being able to live within the community, and it would deter the recidivism, which is the case right now. And we have been advocating for large increased infrastructure to support these individuals, many of whom are cycling like my son, or they're going to prison, or they're waiting for IST to be able to go to a state hospital, that they're sitting in jail waiting for that. We've been advocating to behavioral wellness because the state of California has been making grants available for substantial amounts of money for infrastructure for building infrastructure that can be involuntary and serve this population. But Santa Barbara has declined to use that money for that purpose. And so if they have to send somebody out of county, it's because they have opted to place their emphasis on shorter term treatment, which is not going to work for a certain segment of the population with serious mental illness. Thank you.
Very much. Thank you. Go ahead, Larry.
Hi, I'm Larry Barrett with Indivisible Santa Barbara. I've got three questions. Two, I'm going to ask them as quickly as I can. Two of them I'm hoping are simple. First one, I've seen the estimate of 140 plus million savings for the reduction on the half a bed. Do we have an estimate as to how much we could save in the upcoming fiscal year?
Anyone know that, Larry,
I don't think we can pin that down because um, there's going to be a down payment regardless, and then they're going to finance the project. I think it'll be construction financing, and so when that kicks in, we'll start you know the calendar going on financing costs. Operating costs are projected to be 5 million, I believe, a year once the addition is completed, if it's completed in its current configuration. I can speak to the operating cost problem very briefly by saying I looked at 10 years of the fiscal of our county budget, and over that 10-year period, comparing the first 3 years to the last 3 years, and the last one was 2024, the jail population dropped by an average of 200 people from about 950 to 750. The custodial operations staff increased by 90. So there's some mismatch between the jail staff and the population. I don't understand it, but it's there in the statistics. So I'm concerned that the costs of operation are going to be problematic.
Right.
Gail,
I'm sure
did
you
you want to
understand
add?
why I asked the question and why the supervisors will be particularly interested if our proposal helps them deal with their short-term problem. Second question, February 10th, the meeting, are we on an agenda or would we be giving comments as general comments?
Making public comments there. But I just saw in the chat a note from Brad Wealth from I think the sheriff's department that that date might be postponed. We're going to be following this and letting everyone know, what the exact date will be if it's rescheduled from February 10th. But the way we got the co-response program to begin with, and one of the major ways was that we had 28 individuals from the community who came and told their personal stories about why we needed co-response in the community, and that had a big impact on the supervisors. So we're looking for as much support as possible to save this program.
Okay, but
So,
general
so let me
comments,
just
there's
say,
no
just
item on
into,
the agenda. We're trying
hold
to
hold on a
make
minute,
comments
Larry.
to.
So just to reinforce what's being said, in addition to the petition and the organizational sign-ons, you're asking for people to make public comment and you will be, if how do people learn when the best dates are for that? Do you have a mailing list that you want people to join?
I have a Google group of county mental health stakeholders that's almost 500 people.
Mhm.
And
You just muted yourself. Sorry. You're muted. You're muted. How'd that happen?
yes, thank you. Sorry about that. Um, I have an email list. It's a Google group of almost 500 county mental health stakeholders where I post notices of our meetings and of advocacy alerts. And so I'll be posting there, and then I'll be sending out information to representatives from different organizations. So I will send one to our contact at SBCAN as well as
Okay.
other organizations.
Okay.
So
I'm
maybe
taking
one
this as
thing
a
we could
general
say is
public
to
comment, and
just a
I'm
moment.
sorry. I just want, go
That
ahead.
that as Jeannie posted in the chat, make sure that you are on our list, SBCAN list, and that will be a place because we have very regular now communications on this issue as well as numbers of others. Go ahead, Larry Bernard. I'm sorry.
Okay. Just what I'm hearing is there is no particular item on the February 10th agenda that we want to comment on. We'd be making a general public comment at that time.
Right.
No, I'm
Question
sorry.
which-
No, I misstated. It would be a comment tied to the co-response presentation.
Oh, okay. Thank you. So we'll figure out where that is on the agenda when the time comes.
Thank
Third
you.
question has to do with the politics of this. And with the understanding that Roy is the swing vote, I've also heard conversations about opposition by the county executive and by county council. Do we understand where that opposition is coming from? And is that opposition coming from some concern that the Murray case may require the bed and a half?
Can I address that?
Yes.
Yeah, go ahead.
Yeah, real briefly. I was present when the CEO gave her a report when the Finance Committee had presented its budget. And the CEO said that there was a necessity under the Murray case to go forward with the jail construction. That was flat out incorrect. There was a letter, which we have, I'd be happy to send it to you, from the Plaintiffs' Council saying that jail reduction is something the county has looked at. And she acknowledged that she was incorrect about that. But of course, that wasn't in the public thing, but we followed up with her. And so I think it's not clear that she's opposed to it. What I think is needed is a third supervisor, so 3 out of 5, to ask that the CEO's office present an alternative to 1.5 housing units of what would it look like if just the one unit was involved. So we're hoping to meet with Roy Lee about that, but he really is a pivotal vote. I think it's a tough sell to Steve Lavigno and Bob Nelson.
Right, agreed. I guess Larry, Larry number 1, I would love that letter.
Oh,
I'll put my email in the
great. I'll get it to you. Thanks.
And are you finished, Larry Bernhardt?
Yeah, that's all I can think of.
While you're here, since you represent Indivisible, and I'm very happy that you're here, are there particular activity you want to, we would do this at the end, but since you just had the floor, you want to announce anything for people with respect to things that Indivisible is trying to lead?
Oh dear. Save the date, March 28th for No Kings 3. Date, time, details to be worked out as we're trying to work them out. We have regular protests every Saturday morning, 10 a.m. at Upper State Street, meeting in front of the Whole Foods. We are focusing on particular on ice out of 805, ice out of Minnesota, ice out of everywhere. So you can always join us, if you feel the need to get your protest on. There's one every Saturday morning at 10 o'clock. So if you're like most Santa Barbara residents, you'll come at 10:45.
And anything in the North County that you know about?
Oh, there are a lot of things going on in North County, but yeah, I would look at Estero Bay Indivisible. They are extremely active. But I don't have their calendar in front of me, sorry. Next time I come, I'll try to come with a fuller list.
Okay, and as I said before, be on the SBCAN mailing list, and you'll probably be able to get a lot of that attention for that. Gail Asherenko.
Yeah, thank you. I wanted to answer some of Larry's questions if I could. I have not taken a really close look at the board's agenda for Tuesday, but my understanding is that in addition to the co-response issue coming up, which we would certainly like support for maintaining co-response, there's also an item some of you have probably seen that in the Independent, there was an article about the audit that they didn't really necessarily call an audit because it's not really a full audit of the sheriff's almost $15 million overage costs over his budget that came in kind of, I think it was in August or early September when the county had already kind of closed the books or thought they closed the books. And then we found out there was another $14.7 million that the county needed to cover for overtime and other things. I believe that report is going to be on the agenda. I hope it's not. I hope it's going to be on the department agenda so that people can speak to that. It's definitely a part of what's costing the county too much. So I wanted to mention that there was a question about what would be the cost in the first year. A lot of our costs of saying 147 million is really over like the 20-year period. But the figure we got in April was that the half pod, the choice of adding that extra half pod added $44 million to the construction cost. So, and that was in April. So we don't have, when the board comes back to this issue, I presume they will come because General Services is bringing them back somewhat more detailed plans and costs for the 1.5 pods. And the original cost was like, I think it's like 179 million. I may be off on that. So, we've been subtracting this half pod from other costs. I think, it's hard to say what the first year fiscal year costs will be, but when they approve a contract, I suspect the half pod will be something over 44 million just for construction. And then that will be financed over a long period of time, but they're planning to have at least $50 million ready to put down. The financing works differently. Yeah, I think that's what I wanted. Hopefully that helps clarify some things.
Gail, can I offer a very, very rough ballpark response as far as the
Yeah, because you crunched the numbers a lot.
well, yeah, the total cost for 1.5 pods over 20 years is $460 million. So that's over 20 years. That's operational costs, capital, construction costs, and financing costs. So just rough ballpark. If you divide that by 20, you've got 36, as things stand now, and this is really rough, you've got $36 million a year. Real rough. Just for, 36 million. So I just wanted to add that.
Thank you very much. All right, so we've got things that people can do in relation to this issue. There's been very fruitful discussion to inform a lot of us. Me, I know, has been learning a lot. I'm sure others as well. But many of us have had some experience with the under-supported mental health frameworks in our county in one way or another, and realizing that when we have that experience, how inadequate this is. And that ties into the issue of diversion and of cutting back the incarceration in expenses and suffering that we have in our county. There is something online from Pam Gates about Indivisible in Santa Maria. She's a leader there. Just see all of the. I'm reading this now. There's a protest on February 1st, 1 to 3 p.m. Broadway and Main in Santa Maria, standing with Minnesota and so forth. And then they're going to be testifying at the City Council of Santa Maria on the 3rd for having an ad hoc immigration committee there. I just recommend people take a look at the whole thing she's just said. Are there any other announcements or comments Pam, you want to add anything to that?
No, I just wanted people to be aware of that.
Right.
And
thanks to Jeannie and Ken. They always get the word out, and the silhouette figures that they've created are so dynamic and powerful. Really gets the message across. So thank you
Great.
all, and thank you for today as well.
Well, thank you all for being here, and it's been a very, as I said, fruitful conversation, to say the least, learning experience. Thanks again for Nancy for making this happen. And if there's no other comments, let's all keep our chins up. And that got a
Yeah,
good
there you go.
Thank you, Dick, for having us all. And please go and sign the petition and share it with your friends.
Absolutely. And do you all know how to